Hi, my name's Jeff, and today I'm going to be going over PO meds and injection meds. First, I would start by introducing myself to my patient, getting 2 patient identifiers, and I'm going to perform hand hygiene, provide privacy, and put on gloves. So with any med, when you are giving the med, you want to make sure you check with the MAR 3 times before giving the med to the patient, and you want to make sure you follow your 6 rights of medication. And you also want to check the expiration date with every med. And when you're dealing with needles, you never want to recap them. Right when you give the injection, you want to dispose them in the sharps container. So I'm going to start with PO meds. So with PO meds here, you would have this capsule, which you would not break up. You put it into its own single cup, and when you go into the patient's room, again, you check the MAR 3 times. You're going to have the patient take it 1 pill at a time. They can take it with water or any fluid if necessary, but some fluids are contradicted. And you really want to make sure they take 1 pill at a time. You want to make sure there's no pocketing involved. You want to make sure they swallow the pill, and you want to make sure they kind of take them slowly if there's multiple pills to prevent any choking or that kind of stuff. So next, moving on, I'm going to do my intradermal injections. So to start, I would take an alcohol pad for any injection, and I would clean the site of the injection from the inner out. So with the intradermal, for this video, we'll say we are going to be giving 0.2 milliliters of injection. So I would draw up 0.2 milliliters of air into the syringe, and I would insert that into my medication vial. Then I would tip it over, and now I can draw up 0.2 milliliters of medication. And you can flick it if you have any air bubbles that are present to get those out. So for intradermal, I want to come in at about a 5 to 15 degree angle. I want to pull the skin apart and insert. I'm going to fill my medication up, and I should see a bevel come up and pull out. And again, do not recap. This will go in the sharps container. So next, I'm going to move to my IM injections. And again, the best site is the ventrogluteal, or the deltoid is also used a lot. So again, I would cap off my needle. We would draw up about, we'll say 2 milliliters for this one. Insert 2 milliliters of air into my medication vial. Tip it, and I can draw it up. When you're giving an IM injection, you want to do it at about a 45 to 90 degree angle, and you want to come up and pinch the patient's skin and go in and release, inject your medication, and pull back. Again, discard that in the sharps container. So next, I will be doing subcutaneous insulin. So with insulin, you have regular insulin and NPH insulin. So again, to start, we'll say we're doing 5 units of each. So I would first draw up 5 units of air. And I'm going to first put air into my NPH insulin. Check that. I'm going to pull back, and again, another 5 units. And I'm going to inject this 5 units of air into my regular insulin. Then from there, I'm going to go ahead, flip my vial, and I'm going to pull back my 5 units. Now, when doing the NPH, you want to be real careful to pull back the correct amount of medication, because unlike the other injections, you cannot mix the meds because they're already mixed, so you can't put the medication back in to get it at an equal level. So I'm going to draw up my 5 more milliliters of NPH. Again, if you see any bubbles, you can flick it to get them out. So again, with this injection, you can give it at about a 45 to 90 degree angle. You pinch the patient's skin, insert the needle, insert your injection, and put that in your sharps container. So next, I'm going to be doing my vial medication. So to start with this, I'm actually going to take gauze, and I'm going to hold it away from me. And when holding it away from me, I'm going to come up and break it away. And before I broke it, I skipped a step. You would take the vial and you would mix it, because the medication sits on the top. So you want that medication coming to mix down, or you can roll it between your hands. You can also roll the insulin medication between your hands too if you want to mix that up. So first, I'm taking my clear syringe head, we want to call it, my filter, and I'm inserting that, flipping it over, and we'll say we're drawing up 1 milliliter. Tip that over, and I'm going to remove my filter, and I'm going to insert my needle. Cap off, and again about 45 90-degree angle, or pinch my patient's skin down and inject. And again, with all the medications, you're never going to recap. You're going to throw them in the sharps container right away. And as I said, you're going to check the MAR 3 times before administering any medication, and you want to get your sitch rights of medications. And after that, you would return your patient to a comfortable position and provide privacy, perform hand hygiene, and that's it. Thank you.